Welcome, everyone. I'm Solomon Wilcots, and today we're talking about one of the hardest parts of autism care, getting answers early enough to make a difference. Autism affects millions of families, yet diagnosis often depends on behavioral assessments that can take months or years to access. New research is helping us better understand the connection between the gut and the brain and how that biology can provide earlier, more objective insights. Joining me today are Dr. James Adams, President and CEO of Autism Diagnostic Labs, and Dr. Christina Flynn, its research director and lead author of the recent Molecular Psychiatry paper validating the company's diagnostic technology. And Jolynn Price Rojas, whose son Payton's story shows why earlier answers really do matter. Everyone, thank you for joining us. Ready to have some fun?
Really, Solomon.
All right,
Yes,
Dr.
sir.
James, let's get started with you. And let's start with maybe some of the basics. Why is the gut brain connection and why does it matters in autism?
We've discovered that most children with autism have a major gut infection, and those from gut bacteria and yeast. And those gut bacteria and yeast produce chemicals that leach out of the gut and get into the brain, where they disrupt brain function. And then they're excreted in the urine, where we can measure them. And so we now have a test that allows us to screen for these gut infections. It's very important as a screening test. Does this child have autism? And also gives us a powerful clue that they have a gut infection, which could be treatable and could lead to improvements in their lives.
Christina, your team recently published in Molecular Psychiatry, a Nature portfolio journal. What does this test measure and how is it different from how autism is identified today?
This test measures a panel of metabolites that are derived from the microbiome. It's a screening test used in conjunction with a clinical evaluation by a trained professional, which is currently the only way of diagnosing autism right now.
And so, Lynn, let's hear from you. And before your family found Autism Diagnostic Lab, what was the journey like trying to understand what was happening with Peyton and getting him the right support?
It was hard. It was really hard. Peyton had been diagnosed as autism spectrum level 3 disorder, and he was not able to regulate. He had sensory issues on every part of the spectrum. He didn't eat. It was extremely a time where I walked on eggshells before meeting them. I cried every day in my closet. I had complete uncertainty of what and how I could help this child. And I had tried so many things until I'd met Dr. Adams.
Christina, walk us through the test experience for families from sample collections to results.
Sure. So, first step would be to go online to our website, autismdiagnosticslab.com, order a test kit, receive the test kit in the mail, and open it up. So, what we ask for you to do, or for your child to do, is to pee into a paper cup that we provide, and then take out a sample of the urine into a little syringe that then breaks off. You put that and an insulated pack in your freezer overnight, and then ship it back in the prepaid return envelope. Overall, the process takes about 2 to 3 weeks to get
Mhm.
results.
Jim, is the test available now and how can families order it?
We're excited that now the test is available here in the United States, and families can just go to the website, autismdiagnosticslab.com. They can actually order it themselves from most states, but there are a few states where you do need to have a physician prescribe it for you.
Mhm. And Jolynn, when you receive objective biological information from the test, how did it change the conversation with Peyton's care team?
It changed overnight. It was scientific. We had dabbled in other diets and things before based off of suggestions, and we'd never were ever consistent until we saw the science behind his complete yeast overgrowth. that he was allergic to gluten and allergic to dairy. It was life-changing. From that day on, it was an ability for me to make sense to why his skin was inflamed. And it gave me a lot of answers that I'd been searching for 15 years.
And Christina, how do the study results suggest how this technology can support clinicians and families during autism evaluations?
Well, that's the beauty of it, Solomon. It's not just this study. This study is backed by over 40 other studies that found the same conclusions. There are abnormalities in these specific markers that are associated with bacterial and yeast overgrowth. So hopefully clinicians can use this information in their clinical practice to improve the lives of those who are affected with ASD and their families.
Yeah, and the validation data and the test is an objective screening and clinical decision support tool. Talk to us about the difference between that and maybe a standalone diagnosis.
Well, a standalone diagnosis is subjective because every clinician has their own opinions. So that is not a clearly quantifiable measurement necessarily, especially for those who are diagnosed older. It provides a window into the actual underlying biomedical conditions. So, whether cause or consequence of actual autism symptoms, it can help the person affected by it by helping their doctor help them.
And Jolynn, looking back, what changes have you seen in Payton, and what would you tell other parents who are searching for answers?
The first thing I would say is there's hope. And for this journey, every child is so different. I am no means understand everybody's journey. But since we've done this Anna Ludo's test with Payton, he was originally diagnosed level 3. He was diagnosed level 1, level 2, no longer has an ADHD diagnosis. And those are great to have for schooling and things that I need. But the truth is in Payton. Payton has transformed. He's a kid that I thought one day would never talk to me or speak to me, is now just finished his first year of high school with a 3.68 GPA. He has plans to go to college. And this hasn't been overnight, Solomon, but it's been in 1 year. In 1 year, the transformation that he has had based off of a test that I've taken many tests in Payton's lifetime. I had no idea that this test would affect him in the manners that it has. And people that have known Payton his entire life can't believe the difference that he's in and where he's at today. He's the role model of his school, where once I had to homeschool him because it was not an option. I was afraid for people. So it has changed who he is. He's practicing driving. He just finished chess club, and we're looking for the future. It's pretty
Dr.
exciting.
Yeah, I was going to say, Dr. James, that is exciting news. If there was one thing that you would want parents or clinicians or policymakers to take away from this conversation, Dr. Adams, what would that be?
So now we know that most children with autism have a gut infection due to bacteria or yeast. And if it's treated like Payton was treated, then getting rid of that infection can really improve the quality of their life. And also for other children, it can help us diagnose them much earlier so they can get important treatment much earlier.
Christina, what would you want maybe parents or policymakers and even clinicians to take away from this conversation?
First of all, I'd like all parents to know that they did nothing wrong and that this isn't their fault. I would like policymakers to take away from this that we can save a lot of money by intervening earlier before symptoms are clinically obvious and using the treatments that would already be provided to them years later. If we can close that gap and we can shorten that window, we can save a lot of money on caring for people with autism. And the general public, I hope that we can offer assistance if you ever need reassurance or some kind of objective measurement about what's going on with your child's gut health.
And lastly, Jolynn, what would you to say maybe to other parents, doctors, or even some policymakers who can make a change here?
Autism affects the entire family. It just doesn't affect the person that gets that diagnosis. So if we can help families with answers way sooner than I did, can you imagine if Peyton was able to take this test 13 years ago?
Yeah.
I wouldn't be in this room. I really believe that. So it's pretty amazing that what has just happened. And if policymakers are listening, looking at biology alongside behavior helps us put the pieces of the puzzle together. It's not just one, because it's
Mhm.
different for all of us, but we need all forms of evaluations of our children so we can really help them thrive. And this has been the most remarkable for me. So I hope they're listening.
Very well said. And Joe, thank you for sharing your family story. Christina and Jim, thank you for walking us through the science of why this work really does matter. For decades, autism diagnosis has depended largely on observing behavior. What's changing now is the growing understanding that biology may add another important piece of the puzzle, giving families and clinicians earlier insights and a clearer path moving forward. I'm Solomon Wilcots. Thank you for joining us, everyone.